Order. Governance Committee of the Health Services Board. Holly, you want to take the roll?
Sure. Agenda item number 1 is call to order at 2 p.m. Agenda item number 2 is roll call, starting with Chair Wilson.
Here.
Commissioner Guevara.
Here.
And Commissioner Howe.
Present.
With that, we have quorum.
Great. So our first item of business is general public comment.
Agenda item 3 is general public comment. This is an opportunity for members of the public to comment on any matter within the board's jurisdiction that is not on the agenda, including requesting that the board place a matter on a future agenda item. And for those listening to us online, I'll read our instructions aloud before in-person begins. The Health Service Board welcomes public participation during public comment periods. There's an opportunity for the general public comment at the beginning of this meeting, as well as an opportunity to comment on each agenda item. In-person public comment will be first, followed by remote public comment. For anyone waiting in the room, you're welcome to approach the podium. Each speaker will be allowed 3 minutes to comment in length unless the committee chair deems new public time limits during the meeting. All public comments are to be made concerning the agenda item that has been presented. A caller may ask questions of the policy body, but there's no obligation to answer or engage in dialogue with the caller. The Health Service Board Committee will hear up to 30 minutes of remote public comment total for each agenda item. Remote public comments from people who have received an accommodation due to a disability will not count toward the 30-minute limit. Members of the public attending the meeting via phone can call in by dialing 415-655-0001, enter access code 2663-746-9305, and pound, then press pound again. Press *3 to be added to the public comment queue. You'll hear the prompt, "You have raised your hand to ask a question. Please wait to speak until I call on you." And when the system's message says your line has been unmuted, this is your time to speak. You'll be muted when your time has expired. For those watching the meeting on WebEx, click on the raise hand icon to be placed in the queue to speak. A raised hand will appear next to your name. When you're unmuted in the system, a request to unmute will appear on your screen. Please select unmute to speak. Once you hear welcome caller, you can begin speaking. When your time has expired, you'll be muted. Please click on the raise hand icon to lower your hand. Members of the public are encouraged to state their name clearly, although you may remain anonymous. I'll give an audible warning when your 3 seconds have ended, when the other 30 seconds are remaining, and when your 3 minutes have ended, I'll thank you for your call. You'll be placed back on mute, and I'll unmute the next caller. We want to thank Media Services for sharing this meeting with the public and supporting the meeting. With that, we'll begin with in-person public comment.
Should I just speak here into this?
That's fine.
Hi, my name is Teresa Palmer. Y'all have a letter from me, which Ms. Lopez has informed me is better in general public comment. And I would like that letter published in toto in the minutes. This is a very complicated issue. I'm a city retiree from Laguna Honda. I worked at Laguna Honda for 15 years. And I'm also a geriatric expert. I work with lawyers who are suing nursing homes. And we have a big problem here with San Franciscans, any San Franciscan who is not fabulously rich, who is sick enough to need a nursing home, getting transferred from our local hospitals to bad nursing homes out of county, where their family can't get to them and where they don't get the support they need. And this is especially awful now because Laguna Honda has 100 empty beds. And part of the way, there's a multi-pronged way to deal with this, and the health service system really needs to be part of it. You all have all these things on your website about getting healthier. Well, one of the ways to be healthy is not to die in an understaffed, bad nursing home in San Leandro or Fremont. And city retirees have purchasing power. And I've heard a lot of stories from city retirees about what happens when Sutter wants you out the door or UCSF wants you out the door. And so I ask that you put this on the health service system agenda for November 13th. It's a complicated issue. It will need multiple city agencies to work together to make it better for the people. But health service systems is one of those city agencies, and city retirees will love you for it. It's very important, and it really affects all 6 San Franciscans. Thank you very much. I'm going to hang around later to see if I can talk to each of you. Thank you.
Thank you. And no one else has approached the podium. We'll move to our remote public comment to see if there are any callers in the public comment queue at this time. There are 0 callers in the public comment queue. With that, public comment is now closed.
Right, thank you. So we're going on to item 4. We're going to, is that your timer? Okay. So we're going to look and review the SFHSS rules section specific to the cafeteria plan for plan year 2025. I think the thing I would say on that is that there's going to be a couple of must review areas that Olga's going to review for us that are essentially minimal edits. They're not substantial, but things that we need to do in a timely manner. So we're going to look at this part in particular. Olga, it's all yours.
Sorry, just a quick correction. The title of the item is wrong. It should be plan year 2026.
Thanks for that correction. It was sort of hanging up on me there thinking,
And I'll
doesn't
note that
sound right.
for the minutes. Yeah.
Yes, thank you.
Thank you so much. Olga Stanisca Velasquez, Operations Manager, Health Service System. Good afternoon, Commissioners. Today I will be reviewing the purpose of the San Francisco Health Service Governing Rules, Section 125 of the Cafeteria Plan, and the San Francisco Health Service Rules. I will also take a look at the steps taken to approve the amendments or changes to the rules on an annual basis, and I will make a recommendation to the Governance Committee on the revisions for Plan Year 2026 to the SFHSS rules and Section 125 of the Cafeteria Plan. SFHSS is governed by Section 125 of the Internal Revenue Code. It is sometimes referred to as the Cafeteria Plan. It is a program that employees can use to help employees pay for certain expenses like health insurance and dependent care on a pre-tax basis. Contributions to the Cafeteria Plan are withheld on a pre-tax basis and thereby lower taxable income of participating employees. This means that less federal income tax, Medicare, and Social Security taxes are taken out of participating employees' paychecks. The tax savings to employees through the use of pre-tax dollars can be substantial. As an example, an employee who spends $200 a month in pre-tax dollars on eligible health expenses can in effect save $60, assuming a 30% of the $200 would have gone to applicable taxes. Because of the tax favor treatment when sponsoring a cafeteria plan, employers must subscribe to multiple rules that must be complied with. There are 3 main requirements for establishing and maintaining a cafeteria plan: plan documents, irrevocable elections, and non-discrimination. Employers are required to create and maintain plan documents that are designed to ensure that its cafeteria plan is compliant with applicable laws and regulations. This must be adopted by valid board resolution and is amended in the same way. Employers must ensure that rules outlined in the plan documents are followed. Since failure to administer a plan in accordance with the written terms of the plan and the Internal Revenue Code could lead to potential loss of the tax-favored status for all employees. A cafeteria plan must provide that participants' elections are irrevocable and cannot be changed during the period of coverage. Generally, this is the 12-month plan year. This is known as the irrevocability requirement. However, employers may allow participants to change their elections during the plan year if the employees experience an event that fits within one of the several recognized IRS exceptions. And finally, the Internal Revenue Code prohibits employers from favoring highly compensated individuals and key employees when it comes to eligibility, benefits, and plan utilization. Generally, an annual non-discrimination test is required to ensure compliance. The San Francisco Health Service Rules, or SFHSS rules, are designed to provide clear and structured framework for managing the health benefits offered to eligible members and their dependents. These rules have been adopted by the Health Service Board, consistent with local, state, and federal regulations. These rules serve to ensure equitable access to healthcare coverage by defining eligibility criteria, enrollment processes, and the scope of benefits available. They also establish guidelines for appeals and compliance with regulations in the administration of health benefits. During the annual review, SFHSS evaluates the SFHSS rules and any changes that need to be made to Section 125 cafeteria plan documents for the following plan year. And then we make recommendations to the governance committee. The board can make recommended changes that they wish SFHSS to incorporate for the following plan year. After approval by the governance committee, the changes are brought to the full board for approval. It is recommended that the Governance Committee of the Health Service Board approve today's recommendations to adopt the proposed language modifications within the San Francisco Health Service Rules and Section 125 Cafeteria Plan for Plan Year 2026. The areas where changes are recommended are listed in this slide and are detailed in the appendix starting at slide 9. I am happy to answer any questions the board may have about the recommendations.
Any questions? You have a question? Of
I do have a
course.
question. Thank you for the presentation, Olga. I know this is one of the standard things we do on an annual basis to make sure we remain current. One of the things I do know is that the IRS recently raised the FSA levels to 3,400. Will that be updated as well?
That will be updated next year. We're always 1 year behind due to the timing of when those limits are released by the IRS. In order for us to be able to prepare for open enrollment, all of the programming and the rates or the values have to be known prior to that time. So we're always 1 year behind.
So I see. So the numbers reflect what was published for open enrollment, not necessarily what the IRS has approved for that year.
That is correct.
I see. Okay.
And I can add that specifically for Section 125, it's sections 3.1 and 3.6, along with Section D and Appendix E, we've renewed annually based on those IRS limits. Section C is a change this year due to our reevaluation of the dependent care FSA amounts in order for us to pass the non-discrimination testing mid-year.
Other questions or comments?
If I could, I would just like to mention that as a result of the passage of the big, beautiful bill, there was a provision that substantially increased the dependent care contributions for members. However, given our problem passing discrimination testing at the lower dollar amounts, just increasing the contribution limits for the dependent care assistance plan would have even made that situation worse. But we did want to make those increased contributions available to our lower compensated employees. So for plan year 2026, for the first year ever, we did provide 2 contribution limits, one for highly compensated individuals and one for non-highly compensated individuals up to the new maximum allowed by law. This required significant planning, programming, and communication to our members. And so I'd just like to thank staff for making this happen in a very short period of time. So thank you.
Great. Thank you for sharing that. If there's no further questions, I'll take a motion to approve this.
I move that we approve the SFHSS rules in Section 125 cafeteria plan for plan year 2026 revisions.
Great. Second.
I second it.
Great.
We'll take a roll call vote, starting with Chair Wilson.
Public comment on that?
Oh,
Do we take public comment on
Mhm.
that?
Yes. We'll open this up for public comment. Public comment is now open. Instructions are being displayed on the screen for those watching on SF.gov TV and WebEx. For those dialing in, call 415-655-0001 and enter the access code followed by pound and pound again. Press *3 to raise your hand. For those watching the meeting on WebEx Online, click on the raise hand icon to be placed in the public comment queue to speak. In-person public comments will be first, followed by remote public comment. We'll begin with any in-person public comment. No one has approached the podium. We'll move to our remote public comment. And there are 0 callers on the line. With that, public comment is now closed.
Great, thank you. Roll call vote, please.
A roll call vote starting with Chair Wilson,
Yes, aye.
Commissioner Guevara,
Yes.
and Commissioner Howe.
Aye.
It passed.
Unanimous vote.
Thank you.
Thank you.
Okay, on to the next item is item number 5, to initiate the public employee evaluation of the SFHSS Executive Director for 2025. Thank you. Just a couple of comments teeing this off. So we have had a survey process in place. We actually discussed this back in our March meeting. It's been a similar survey for the last 10 years. Again, we're going to look at surveying, the importance of surveying. I think the point of discussion will be, do we change surveys in any manner related to this upcoming survey or not? And then we'll, from this, we'll then go to the next step, which will be the board self-evaluation, which is a separate one. So I open it up for discussion. Are you presenting it there, Holly? There you are, sorry.
Yes, I'll pull up a presentation and walk us
Perfect.
through.
Thank you.
So hello Commission, Holly Lopez, the Board Secretary for the Health Service Board, and I'll be presenting just a few short slides to help us walk us through and then guide the conversation, as Chair Wilson said. I'm coming to you today to present the materials that would initiate the annual performance evaluation, and the committee then will have time to recommend to the full board both the criteria for the executive director's evaluation, and the committee shall have the authority to edit any of the tools or the timelines. And the recommended changes would then go before the board on November 13th, next week at the full board meeting. And as in past years, myself, the board secretary, would administer the approved evaluation tool, analyze the results, compile the data into a report that would then come back to the committee in the beginning of the year to review in closed session. And then, of course, then that would go to the full board. So the materials that we have today are the timeline, which is here on the screen. And like I said, today initiates the process. We would go to the full board for final approval on November 13th. And it would take us through the first few months of the year. We'd also include Executive Director Guillen's self-evaluation. The committee would meet again, and then ultimately, not scheduled yet, but in February, we would have another governance committee meeting to review, and it would be finally approved in closed session on March 12th. I can pause there, just if there are any questions about the timeline. Okay. So now we can go into the evaluation tool, which was also in your packet. The reporting period, or just to set the stage, this falls within policy 204 within the Health Service Board policies. The board members are expected to complete the survey as it's designed, and a designated staff would also be contributing to those survey results or contributions. The reporting period is typically January to December of each year, knowing that Executive Director Ray Guillen was appointed on May 12th of this year. The evaluation tool addresses 5 areas: the leadership and vision, the resource management and governance, management of people, collaboration and communication, and client services focus. And there's a 5-point rating scale from exceptional performance to unsatisfactory performance. Each question requires that point rating system. And if 3 is rated, then there's no comment that's required, but a 1, 2, 4, or 5 would require the board member to provide commentary on that scoring. It's also typical that the Health Service Board, along with the Chief Financial and Affordability Officer and the Chief Operating Officer and Experience, would also complete the survey. So there's a multi-perspective on the performance. The committee may wish to discuss the designated staff this year, knowing that the Chief Financial and Affordability Officer and the Chief Operating Officer and Experience Officer have both joined the department recently. So it's something to discuss. Accompanying the evaluation report would be the director's self-assessment. So they receive these 5 scoring areas, rate themselves, provide evidence of those work areas to be included on top of the evaluation tool. So with that, I'll hand it over to the chair and any discussion, and I'll take notes of any edits or changes.
Right. Thank you, Holly. So I am a fan of evaluations, but I also think evaluations can sometimes get sort of stale. This might be getting into the stale category in the sense it's been the same survey for 10 years. That said, just sharing my own thoughts here, so I'm interested in what others think. I think actually in this time where our new director is new in the role, it's maybe not the time to change the survey because we'd like to have the piece of comparability, recognizing that it's a shorter time frame than the previous. So my suggestion is that we actually maintain the current survey in its current format. I do know that the minutes from March, when I thought you suggested that we might try trimming down some of the redundancy in my mind, that we do potentially this spring after we do a cycle with this. That's just my thoughts on it. I'm interested in what my peers think.
I agree that now is not the time to change it because I think that it would probably mess up the timelines as well that Holly just explored with us. So I actually think that these various sections that describe the attributes of the position, I think they're very thorough. So, I mean, possibly there could be things that we could tweak to examine further to see if they're still relevant.
Yeah.
So, yeah.
I concur with the two.
So I think we look at maintaining the current survey and then taking probably offline after this cycle, if there's ways that we want to your point, sort of tweak. Are there questions that we're not asking about, areas of relevance that we're not touching on, and give it in some way, a little bit of a refresh without, again, it's not a wholesale, we're not throwing the whole thing out, but we're just seeing if we can refine it. So with that, I guess I would take, public comment.
Or
Sorry,
I'm
Holly.
just to mark when the committee would like to review it. We'd be meeting again in March, which would probably be an appropriate time so that the executive director knows any new
Yes.
guidelines to follow for the following year. So it would go back onto the March committee meeting to review the evaluation
Any
tool.
changes?
Okay.
Sounds reasonable.
Okay.
Okay, our multitasker, she's back in a different chair. So I think, do we ask first for public comment and then take the motion? Did I get that right?
Take the motion.
Take the motion. Okay, sorry. So I would accept a motion for this recommendation.
I second it.
Okay, well, I'll make the recommendation that we adopt the 2025 Health Service Board Annual Employee Performance Evaluation and Timeline. Thank you. Seconded. Great. And now we open for public comment.
And public comment is now open. Instructions are being displayed on the screen for those watching on SF Gov TV and WebEx. For those dialing in, call 415-655-0001 and enter the access code followed by pound and pound again. Press *3 to raise your hand. For those watching the meeting on WebEx online, click on the raise hand icon to be placed in the public comment queue to speak. In-person public comment will be first, followed by remote public comment. And no one has approached the podium. We'll move to our remote public comment. And there are 0 callers on the line. With that, public comment is now closed.
We'll
Roll
take a
call
roll
vote.
call vote for this, please.
Starting with Chair Wilson,
Aye.
Commissioner Guevara,
Aye.
and Commissioner Howe.
Aye.
Unanimous.
Okay, on to our next topic, somewhat similar. That's the board self-evaluation.
This is agenda item number 6, which is to initiate the annual Health Service Board self-evaluation, an action item introduced by Committee Chair Wilson, and I'll be presenting. Welcome again. My name is Holly Lopez, Board Secretary, and I come before the Health Service Board Governance Committee to present the materials to initiate the annual board self-evaluation, which is found in Policy 203. The Governance Committee shall recommend to the full board any criteria that's discussed today and has the authority to approve any edits to the evaluation tool and the timeline. The committee any recommended changes today would go before the full Health Service Board on November 13th, next week, for final approval. And as in the past, myself, the board secretary, would administer the approved evaluation, collect the evaluation results, analyze the data, compile a draft report that would first go to the governance committee and then to the full board. And that's outlined in the timeline on the screen now. And as very close to the board's executive director performance schedule, displayed here, it would start in January, continue into February, and finally be reported out in March of 2026. And a note that last year there was a completion time of 3 weeks. We're shortening that down. That actually fits the outline in the board's policy for a 14-day turnaround. I'm going to hold off for just a second. Any questions about the timeline or adjustments?
Or the what? I'm sorry.
Or about the timeline? Any adjustments to the
Sure,
timeline? Or
it's fine. Very
Okay.
reasonable, thank you.
I think for me, I just would like to understand a little bit on the health service self-evaluation. We submit it within 2 weeks, and who is reviewing our self-evaluation to confirm or acknowledge?
Yeah, I can explain more. So the survey tool is within Microsoft Teams. There are about 42 questions. I see those results. I'll compile them into the sections with percentages and how many board members selected each rating scale. That's a full report. It's public. It'll come back to the committee as a draft, have discussion of where the committee may see improvement areas and a focus area for the following year. Once those are compiled, it'll go to the full board, and the board will then get to accept them as well.
Thank you.
All right, we can move into the evaluation tool a little bit deeper. It's this same outline. It's a January to 2025 to a December 2025 self-evaluation. There's 3 sections to the entire survey. The first is performance, and that is regarding governance structure and policies, interactions and meeting activities, goal setting and communication, and the board's interaction with management. The second section lands on educational topics, so an area for the board members to suggest topics they might need or could be useful in decision-making for the following year. And then a report on self-study hours, which is required in the city charter to report those hours. I do have this final slide. It lists notes from the March 2025 Governance Committee, areas that the committee wanted to focus on. What's not listed on this slide, very similar to what Chair Wilson said, is that the duration of this tool has also been a 10-year span. So that could also be discussed. I'll leave this up and we can go through the evaluation tool and I can take any notes for changes.
I'd like to ask a question.
Go for it.
Hi. So I know we've done this year after year, and I know that the late Commissioner Scott particularly liked this tool and was proud of the fact that we are maybe the only commission in San Francisco that evaluates its own performance. But I think Realistically, I think for the areas where we have not scored as high as we had hoped or where we've seen a dip in our scores, I don't know if there have been any real opportunities for us to like explicitly address those things. So I think I'm just throwing it out there that if we continue with this practice, I think that we need to actually focus on those areas and somehow build them into our already very hefty agendas. So I'm just throwing it out there to say, like, are there strategies for us to pursue that you can recommend for us to think about? Because when we get together, we do it for business purposes, and so we don't really have any sort of like team building moments. So, yeah, I just want to throw that out there for food for thought.
Go ahead.
It sounds like what you're saying is you get the results back, and then there's not another opportunity until the next to actually check in or discuss how the progress is going or improvement along the way. And you're right, the committee does need to gather in the public to be able to discuss those. So one opportunity could be an additional governance committee meeting somewhere after that to say, yes, we know that these are the areas we want to focus on, but another committee meeting could check in on those. If there, for example, if there's an area about, let's give an example, about goal setting within the board, we could have another session where are those goals being met? How are they being met? Is it effective to the people that the goal needs to pertain to? So that's one option. Is that along the lines of what you were thinking?
Right. I guess it's what do we do with the data after we compile it?
And I think that's maybe a little bit where, looking back at the minutes from March, I think there was a sentiment that maybe it was a hefty, it took a fair bit of time to do the self-evaluation, and that maybe that too could do with make it a little skinnier, because we're not sure how we can really act on it. And I'm not sure that we had 100% participation in the prior survey, or did we?
I think it was 7 out of 8 last year.
Yeah, okay.
Yeah.
Right.
So it's certainly open for the committee once we get those results, how throughout the year to address them and to make those improvements. The committee would have the opportunity to decide, and then in support with the administration, myself, to support reaching those changes.
I guess ultimately too, I mean, I don't have an opinion about this, but I'm just going to ask the question, like, how useful is it for us to continue this practice? So I'm kind of neutral on that. I mean, I think that if we do continue, I'd like to figure out how to weave in those areas that we find we need more work on. Yeah.
I think that's why I was questioning the self-evaluation or the board. So yeah, sounds like it needs to be rethought of as to how it can be effective going forward, not just exercise process that doesn't have a lot of meaning.
And I think some of those things that you have up on the slide, I think that even, for example, numbers 21 and 22, that we don't establish goals, instead we, affirm. And I even see that reflected in the terms of reference later on, that we don't approve the strategic plan, but we review, or basically it's a less active verb that got changed to. So I kind of see our role as, supporting and, obviously giving our thoughts into how staff addresses member needs and establishes the plans, et cetera. But I think ours is not to interfere with necessarily or disrupt the work, but hopefully we are lending our best thinking to help with the leadership of the department and service to the members. Yeah.
Yeah. So for in the section goal setting and communication, number 21 and 22, that could be an example of changing the verb. Instead of establishes, it affirms, as you're saying, because the administration sets those goals, but the committee or the board would be able to affirm that those are in line with reaching the department goals as a whole. So I can make note that those two change to affirm?
Or whatever it is, but I think that that was one of the bullet points that you have
Yes.
on your slide, right? But I think that, so I'm sorry, I'm going to get picky about this. So even if it were to say that we affirm it, so what? You know, like what are we evaluating there? So that's just my opinion. So what?
I'm not in disagreement here, actually, and I think this is where was well intentioned to. It's basically asking for accountability. That's what the survey is.
That's fine.
And that, but there's probably a thinner way to do that that doesn't feel awkward.
Yeah.
And I don't recall what the actual distribution of results were on the prior, and even what would that even really mean? Is 3 good or is 5 good? Like, just it's a little hard to sort that out.
Yeah.
Chair Wilson?
Yeah.
Yeah, I appreciate the comment, and I think I have also had similar thoughts. Again, as executive director, I'm here to administrate the policy that this board sets. But I've, just noticed in my time with the health service system, oftentimes we're bringing you items to approve that you don't really have enough time to provide feedback and for us to change the recommendation. So part of my goals recently have been to try to rework the schedule to bring items to you in time for the board to recommend a different action and for us to still come back in time for you to approve that. And so I think through this self-evaluation process, I know that as city employees, when we evaluate their performance for 1 year, we're also setting the performance plan for the next year. And so that the employee knows kind of the path that they need to build upon their skills and performance. And so it's not the same here, but I do think that working together, we can take the self-evaluation and come back with kind of the plan for next year to improve on the board self-evaluation. So the areas where there's room for performance, I think working with the board secretary, staff can come back with kind of an amended education plan that includes some of those areas incorporated into that. And so I think for this coming year, I think as part of the March meeting that we can bring such plan to you. And again, this will be a learning process, and so we'll take our best stab at it. But again, we do think want to support you in making this tool useful.
Great. I appreciate that. Thank you.
And I have to correct myself. I did say the March meeting, but our calendar actually brings in February. So that's the next governance committee meeting, and the governance committee could meet on the topic that Ray just described, and then it would go for final approval into the March meeting. Okay, so that's noted that there would be a deeper dive into redesigning or evaluating the tool. Would it be helpful to go through these questions, like Commissioner Howe, you said, in detail, if we wanted to change those language where you saw? Do you want to change the language on 21 and 22?
If we were to change the verb in 21 and 22 to a more accurate verb, then I guess my question remains,
How useful is this?
how useful is that question? So,
And it's possible to strike the question too.
Is this more for satisfying our role for the city as far as the recognition of what we're doing? I mean, helping with establishing the role, a goal. Is that part of this?
Well, it does tie, when we see the word goal, the goals are, there are strategic goals, strategic plan for the entire department. And we will talk about that a little bit in the next agenda item about policies. And so this could have in its origin related to the goals for the whole department. But those are, you're right, those are designed within the strategic plan and not necessarily for individual divisions of the department. So yes, they this question 21, which is the board establishes suitable goals for the organization as a whole. This isn't necessarily an annual task if it's approved within the strategic plan. So it's not necessarily relevant every year. And the same thing with the board establishes suitable goals for member services. I'll defer to Executive Director Ray Guillen, but I do believe that the administration comes up with divisional goals that may be adjusted each year, but those aren't brought before the board to approve.
Or can we, for 21 and 22, maybe something about the way we participate, as a board, like, do we provide effective feedback, about goals for the organization or goals for member services? And so, or things like that. Because if it just says that, we reviewed it, like, yes, yes, so, or no.
So I guess a question I want to pose here, are we suggesting that we would actually just take the survey, have it come back in February, sort of revamped, if you will? Maybe less, maybe ties to something more strategic, maybe shorter, but we're not choosing the survey tool today like we just did for the executive director, which I think it fits into a calendar that feels tighter around performance.
Well, the agenda item today is to approve the tool so that you can reflect on the 2025 year. So bringing it in February to redesign it gets just farther out from the year to remember what those goals were. The other option is in the February meeting to redesign the tool for the 2026 year. Yeah.
Right. What I thought I heard you say was basically make the necessary updates and changes for the 2025 tool so that we can
Administer
it. And then in 26, we do the deep
More
surgery.
substantial.
Mhm.
Yeah.
Okay, I think that's said well.
Yeah.
Okay. So for 2020, for question 21 and 22, how would you like to adjust that language? Or strike it from the survey?
What I heard was to evaluate for a redesign. Is that right?
So
As
redesign
to whether-
for what we'll do next.
For
maybe
next year, for 2026.
But this one is sort of a tweak, if you will, right?
Okay. Mhm. And would you like me to propose changes to it, or
So
do you
if
want
the
to?
board advises suitable goals, or do we even advise?
Provides
Affirms.
feedback to or something like that, because I think that's what we have done.
Yeah.
Like, for example, when we, I don't know, we've gotten a lot of comment or feedback from our members about member services, then, we ask, how come the dashboards, the metrics on the dashboard is going backwards,
Right.
et cetera? Like, what can we do to help advocate, or like, are there things, like ways that we support and provide feedback for? That would be my suggestion, but I know it doesn't elegantly change the sentence, so. Because then I feel like that's a measurable thing of how well we participate in the department's goals.
Right. So then the question would be, board members would be able to agree or disagree or stay neutral on how effectively you provide feedback to the department.
Something like that. But this is on a 5-point scale too, right?
Yeah. Yeah. So yeah, it's on strongly disagree, neutral, agree, strongly agree.
Yeah.
Okay. So providing feedback both for the goals of the organization as a whole and providing feedback on goals for member services. So we keep the two questions, just changing establishes to provides feedback.
Yeah. I'm not wedded to that, so I welcome feedback.
I think that was a reasonable change.
Okay. Okay. Let's move on then to 23, same category, 24 and 25. 23 is the board communicates effectively to staff. Number 24 is the board communicates effectively to service providers. Number 25, the board communicates effectively with one voice to all parties. And having looked back on the transcript and the minutes, I think there was a question on how the board communicates to service providers, which is in public meetings. There's an agenda item on reports from represented health plan representatives, and that's an opportunity. But beyond that, I think there were questions in the survey in the past saying, beyond that, is there anything more than just that section to consider when answering this question? So clarity, if the question feels clear enough, or it needs to be more specific for number 24.
Or what's the purpose of that question? So what is it trying to measure? That we're mean to them or we're nice to them? Or I mean, no, in all honesty, what is that trying to measure?
It's a good question. Again, having not known the source, I think there's many times within a board meeting that board representatives are there, and to be able to ask them to produce something or to come back. I think it may also be connected to question number 25, which is to all parties in one voice. That's a little can be confusing too. Like, does the board speak in one voice to service providers? Do they speak, and if there are any other ways they can speak? So I agree, it is confusing on what's the outcome of that question.
So can I suggest that we make the changes to the questions 21 and 22?
Mhm.
We leave 23, 24, and 25 as they are currently, with the likelihood that they may be on the chopping block in some way for a redo and a simplification of the survey. I remember it took quite a bit of time. And I was like, to what point? So I think that's goal 2. So goal 1 will be make these small changes, accept it in the timeline. And then in February, we've got a little work to do.
And it sounds like a rubric that we would bring to the February Governance Committee meeting is going through the questions and asking what is the purpose of this question and how would we improve if possible.
Yes.
Okay.
It also seems like 9 months out of the year, we're in a blackout period with somebody. So
Mhm.
we can't talk to them anyway.
If I do, I'll have to kill you. Yes.
Okay, so we had time to address the questions from the March meeting. Were there any other questions that may want to be reviewed today?
I think we're good. Thank you, Holly.
Okay, then I'll make a note to change questions number 21 and 22, and that would be the only change for this year. And this is an action item, so there.
Yeah, so we'll move to approve the board self-evaluation that we just hashed through with the couple of edits of question 21 and 22, as noted, with the current timeline.
Second.
Public comment.
Public comment is now open. Instructions are being displayed on the screen for those watching on SFGov TV and WebEx. For those dialing in, call 415-655-0001 and enter the access code followed by pound and pound again. Press *3 to raise your hand. For those watching the meeting on WebEx online, click on the raise hand icon to be placed in the public comment queue to speak. In-person public comment will be first, followed by remote public comment. We'll begin with any in-person public comment, and no one has approached the podium. We'll move to our remote public comment. There are 0 callers on the line. With that, public comment is now closed.
Great, thank you. And we'll do a roll call vote.
A roll call vote starting with Chair Wilson,
Aye.
Commissioner Guevara.
Aye.
And Commissioner Howe.
Aye.
Unanimous.
Unanimous, thank you. Okay. We're on to item number 7. This is, Holly, I think you're doing this also, right?
So this is agenda item number 7, which will initiate the governance policies in terms of reference for the 2025 year review process and timeline, and as well as an action item. Hello again, Holly Lopez, Board Secretary for the Health Service Board. There's not a presentation attached with this agenda item, but I'll be walking us through. The Health Service Board terms of reference and policies are reviewed at least every 3 years to ensure that they remain relevant and appropriate. This goes before the committee first. Today I'll be presenting a timeline and the first draft of edits. The committee will then recommend any changes for final edits to the full board. The final edits would go before the full board in December to give any time to recompile edits. And as in years past, I would be supporting the board to administer any changes that come after this meeting if needed, and compile them again, bring them back for full board review. So the timeline would be that if we're going to discuss today, we'll be reviewing draft edits from staff, which come from myself, reviewed by Ray Guillen. And if there are more recommended changes and language needed, we would extend a deadline for the committee to submit those by November 14th. Then there is a public notice requirement. So on December 1st, it would be notified to the public that at the December meeting, those policy changes would be reviewed and finalized for the full board to approve. So these are pretty heavy documents. I'm not going to post anything, but they're redlined. So as of right now, what's publicly available is the governance policies in terms of reference. It was last revised in 2023, December 2024. And in the posted redline document, there's several types, sort of categories of edits that were included. So there's grammar and formatting, which you kind of see throughout. I'll go through some of the substantive changes. And then there's areas for suggested review by the committee. And then I'll be taking notes along the way of any changes or edits. So in the first section, on the very first page, when we open this up, there was a introduction draft language. And over the years, there's just been notes that I have taken of how do we introduce this to the public? How do we make things more clear and understandable? So those paragraphs were drafted. They were pulled from other sections in the full document and can be edited. And I can stop on each one of these sections, or I can kind of go through all of the edits. What's your preference?
Is there a strong feeling about going line by line? I mean, I would just say that I think that these are good edits. And I think really thinking about the goal to me is to make this terms of reference as complete as possible. So I think when I looked at it, and I think Holly and I talked about this, pulling in some other lovely things we have, like glossaries, and just having it all in kind of one place. So you're not hunting all around the website to find information. I think you have some of that in here.
So the opening paragraph, we can go through together, or there's a few other policies to make note of.
I would prefer that we spend our time on the policies and we can come back to the intro. I mean, we can submit any sort of wordsmithing to you for the.
Correct, yeah.
I agree.
Okay, so then the next one would be policy 201, which is the SFHSS board operations policy. And this was actually more of a grammar notation that was found after the publication. And you might see on the bottom of page 21, there's in parentheses a reference to membership rules and regulations, A3C. And I've checked with Olga Stavinsky-Velasquez, and that is not a true reference to anything. So I would be making those edits. I checked in with Executive Director Ray Guillen, and we believe that those are more associated with the charter and the admin code. So it's not redlined in the document, but I would need to go back and correct that reference. That's all there is in policy 201. Moving on to the next one, in policy 203 under board education, there are some appendixes. On page 30, we'll start with page 35, there's a travel appendix, and that's where there are substantive changes. We consulted our finance division and made sure that those recommendations and guidelines aligned with both our department policies and the city policies. So you'd see red lines about how much we can tip and when to submit receipts. Those are the substantive recommendations. The next two to take note of these are more suggestive for the committee to review. Within policy 203 in board education, on page 33, there's an appendix about conferences. There's the board education allows the board to participate in conferences. And on that one, there's only one organization listed. So that's something to review. And very similarly, on page 40, within the same policy, there's an appendix about education resources, which has a fuller list, but may also be outdated or rotate. And so for the committee to make any suggestions about what would actually be helpful in a document like this of policies in terms of reference, that how can this be more evergreen or which ones may not be relevant anymore. So we can discuss that. And then policy 205, health service system monitoring and reporting policy. And that's if we look at page 46, also an appendix. There's scheduled board reports, and there are several that are to be determined. So this is a suggestion for the committee to see if those need any clarification or how that type of reporting could be shared throughout the year, as opposed to being more static in this document. Those were the ones to highlight. We can go back to any one of those in detail, and I can take notes on any suggestions or edits.
And Holly, remind us again the date that you would need any suggested edits.
On the draft template,
Yeah.
I proposed next Friday, the 14th. That could be extended if needed, depending on the need. So, yeah.
Would you be able to send this to us in Word?
Yes.
Okay, thank you. Maybe share it with us in Word so that we could have
Yep.
version control.
Totally, yes.
Okay. So any discussion around page 33, Appendix C, how that may be updated or adjusted?
I'd like to just send a couple edits, so that's why I was asking about the turnaround time. I don't know that we want to do it here. It doesn't feel like good use of people's time, but I'm happy to make some edits to that area in particular.
Okay. And then any suggestions or edits on page 40 to Appendix 4, Education Resources. Page 40, excuse me.
Similar answer.
Okay, submitting.
Delete comments.
Commissioner Guevara, that was expected deletions, you're saying?
No, I would like to defer till next week
Okay.
for my comments. I mean, I did read it, but I'd like to be a little bit more clear.
These are all just external providers, right? This does
Yes.
not include our annual ICE Miller training and RIN's fabulous HIPAA training, et cetera.
Correct, yeah.
Okay.
So there are 10 listed resources here. For example, California Healthcare Foundation or Kaiser Family Foundation or Integrated Healthcare Association, and they're active links, but none of those are internal.
Okay.
Correct, yeah.
It's kind of a hodgepodge list at the moment, so actually my edits will be somewhat of a hierarchy because I actually think some things there are very much policy-based, some things are more tactical, and I think that I'll try to fix it or make suggested edits.
So those will come in suggested edits as well from committee members. Okay, I can
Thank
file
you.
that. And say the next appendix to consider would be page 46, scheduled board reports. And this would be one that if there's suggestions that the HSS executive team could also contribute and possibly suggest first, unless there was a direct request of wanting to have the investment performance given by a certain date of the year. So those could be brought back in the edits as well.
So I'm sorry, you just want us to, what are we looking for repeat what our goal is for this page, this table?
On page 46, the scheduled board reports, there are several that are sort of left hanging, the
Yes.
to be determined. And so the HSS executive team could come back and give more concrete dates if desired, or if there was a desire from the committee when those should be delivered or how often, the frequency.
But the column header is presented by, it's not,
Oh, you are correct.
it's not a, it's a person versus a date. So,
Correct. Yeah. I had overlooked that. If that is, that could also be updated, but it's not necessarily input from the committee. That could be just assigned from HSS.
or like CFO or designee, or whatever, for example. So,
Okay. So that would be more of just bringing that edit back to the committee.
Okay.
Okay. Okay. So those policies, policy 201, 203, and 205, would be the ones to look for any edits. In the next week, the committee could supply further edits, and as long as they're pointed out, probably with track changes very clearly, so that when they are presented to the public again, everyone knows which ones we'd be changing. The awareness that I have, though, is that if we bring these back to the full board committee, would we skip a governance committee meeting and just have the full board accept all? Or would this committee want to meet again to review?
I don't think I don't have a sense of how many edits people are going to toss out. I
Yeah.
can see a couple areas that I want to make better, but
Yeah, but maybe what you could do is consolidate our recommendations and then show it to us
Mhm.
again via email. And then from there, we can acknowledge that we're all the same.
Yeah.
we can just also provide brief, like if it's something, substantive, we can tell you why we believe it should be different.
Yeah, I think what I'm hearing too is that I can compile into a short chart. We had a great example in the rules and cafeteria plan section, so it's very clear that this is what's changing, so that the full board could accept and
Yeah,
adopt.
and we're all in the same page with
Yes.
our requests.
Okay, makes it simple. All right. So with that, this is an action item. Oh, excuse me. No, there's one other section. As it currently stands on our webpage, there's an additional document. It's supplemental. It's the San Francisco City Charter and Administrative Section Codes that are applicable to the health service system. And this is truly supplemental. It is lengthy because it's copy and paste from the legal code and the charter. It's put into one document, so it's very quick to reference. And so I went through and I looked at sections that address the health service system or the health service board. And there are actually 7 that are redlined. There should be 8. And the first section, there were several, charter section 4.100 is general. It just wasn't in this supplemental code. It existed, it's followed. There's the next section that was added was section 400.100.1, and that's the Commission Streamline Task Force that was created in 2024. So it's new to reference. Section 4.101, 4.101.1, 4.101.5 were in the charter and the admin code, or in the charter, and they were just not included in the supplemental document, so it was added. As well as Administrative Section Code 16557.1. It has been active, it just wasn't in our supplemental document. The last 2 remaining, the Administrative Section Code 16700 participation section was updated in 2023, and specifically the number of boards or commissions that are allowed to have access to HSS health benefits was changed. So it was reviewed by the Board of Supervisors and the ordinance was changed in 2023. And then the last section that was updated was Administrative Code section 21.02, and that's the definitions that was updated this year. So with these changes, the supplemental document would be updated and current, so it's easily accessible. And I would also recommend that right now on the website, it's a big bundle. It's our policies and reference code bundled with the charter, and it makes it a document that's over 200 pages, which is not necessary. So separating those out. So when this does go before the full board, it's just the policies in terms of reference separate. And especially because the policies are the ones that are the action item, the supplemental document is separate. It's additional. So with that, are there any questions about the additional sections applicable to the health service system board?
No, I guess I'm just wondering, is it necessary to cut and paste into a separate document? Can you just provide the links? Because if there are amendments that, ordinances that amends a particular section, I don't know if our website can always keep up with those amendments. So
That's a very relevant question. If we are only reviewing these documents, the policies every 3 years, that document also doesn't get updated regularly. So that certainly we can see how it can be more active on our webpage.
yeah, I was just talking about more of the charter and the admin code
Mhm.
sections. Yeah.
Yeah.
So
Mhm. And that's something we can work with our website design too, to see what's easy to access. Okay. So the action item would be to adopt the timeline for these changes. And then, yeah, for these edits and changes, knowing that additional edits are going to be given to the committee due next Friday to the board secretary.
I'll take that as a motion.
so moved.
Great. I'll second it. Give Holly a chance to sit back down.
Can we repeat the motion?
So, okay, I'm going to try that we initiate the governance policies, terms of reference 2025 review process and timeline. And I don't know if we need to also include that we make more friendly the document. Okay, we'll just,
With final edits pending.
yeah, with final and it's pending from
11/14.
committee members.
Mhm.
Correct.
Moved by Commissioner Howe, seconded
Seconded by
by,
me.
and with that, we can take public comment. Public comment is now open. Instructions are being displayed on the screen for those watching on SF Gov TV and WebEx. For those dialing in, call 415-655-0001 and enter the access code followed by pound and pound again. Press *3 to raise your hand. For those watching the meeting on WebEx online, click on the raise hand icon to be placed in the public comment queue to speak. In-person public comment will be first, followed by remote public comment. We'll begin with any in-person public comment, and no one has approached the podium. We'll move to our remote public comment. And I can see there are 3 callers on the line. And I'll give a 5-second pause for any of the callers to raise their hand. There are no callers in the queue at this time. With that, public comment is now closed.
Great, thank you.
And a roll call vote, starting with Chair Howe.
Chair Wilson?
Excuse me.
Chair Wilson.
Chair Wilson.
Aye.
Commissioner Guevara
Aye.
and Commissioner Howe.
Aye.
All right, and with that, we adjourn at 3:09. Thank you.
Thank you. Ollie.